So I think it's really important that we talk about stigma in healthcare providers. We're dealing with a very complicated issue in our community that is the disease of addiction. First and foremost, it is a disease without question. It's just as complicated as diabetes or heart disease. It's chronic, it's challenging to manage, and between the physician or clinician and the patient, it's very important that we recognize that fact. We all know that we have a long road in order to make an impact on the disease process across the country, but specifically in our region. And people often ask me what the most important thing they can do now is, because they want to do something now. And I say, you know, the two things you can really do are prescribe and support naloxone or Narcan services in whatever way, shape, or form that you can. If you're an emergency physician, prescribe it when you think it's appropriate. If you're other practitioners of any sort in any other field, you also can find the criteria that make you feel comfortable prescribing it or supporting it with grants or however you feel. But as important, if not more important than that, life-saving medication is stigma. I see a lot of patients who come in very fearful of the medical care that we're trying to deliver to them because they've been mistreated in so many scenarios in the hospitals. And they're just people with a disease. And I often ask my colleagues, you know, would you mistreat a thin old lady with COPD because she continued to smoke? No, you'd ask her to stop, you'd help her to try to stop, and you'd treat her COPD because she has that disease. So I think that as healthcare providers of all types, but specifically physicians, you know, right, wrong, or indifferent, we do lead some of the medical mindset of things, and we are responsible for working on the issue of stigma as a specialty. And as the kind of somewhat designated leaders of healthcare, we have to portray to the rest of our healthcare community that our patients have a disease and they deserve appropriate and compassionate treatment for their addiction. So I tell people that it's very important that they're careful with the words that they use. In fact, you know, the newest terminology is substance use disorder. That's a little confusing to the layperson sometimes. The disease of addiction is okay. The word addict even has its own issues and stigma, even to the patients. And you'll hear them call themselves these stigmatized words, unfortunately. And I try to move them away from that, because it's important that they understand that they're patients with a disease. And so we are very careful with our terminology here at the treatment center that I run, for ourselves, with the patients, and across the board in all of the interviews and things that we do. It's not a dirty urine, it's a positive screen, right? I'm running a drug test. It's not laundry, right? So it's just that word, kicking people out. I told you earlier, it's just, we don't kick people out. In fact, that if you kick people out for having relapses, you don't even understand the disease in the first place, to be honest. So you're not kicked out. You may be referred for a different level of care if that's what's appropriate. To the same extent, again, take every model of disease that you've ever thought about other than addiction and apply that to addiction, and it doesn't seem so strange anymore to say that I'm going to take care of this patient. If you saw a diabetic and they ate a cheesecake and you said, "Get out! You ate that cheesecake," you wouldn't have patients very long. And we don't treat any other population like that. With anger and regret that we try to take care of them or anything like that. So we were very careful about, we need to be more careful about the words that we use in the medical community, with the public as representatives of healthcare, and specifically with the patients themselves. I think the biggest consequence of stigma is that the patients don't seek care. You know, like I said, a lot of our patients come to us having been mistreated in other healthcare scenarios. And so they are afraid to seek the care, and even when they do seek it, they are still distrustful, which I understand. The other issue that's very interesting that I've come to realize is that some of the healthcare providers, even in the field of addiction, feel that they are entitled to treat the patients that way, and I don't understand that at all. Or that the patients should feel, very welcomed. Well, that's not the right word. That the patients should feel privileged to be in their treatment center. All right, just because I gave them this treatment, they should accept it and never question anything. And again, I think the basic premise is go back to how you would treat a patient with any other disease. Get your mind wrapped around that concept, and you won't feel that way towards the patients. And so I encourage and challenge the clinicians in the field, and it's tough some days. I'm not going to tell you I don't get upset and I don't feel like someone is trying to, manipulate or whatever. But again, if you're a clinician in the field of addiction, you ought to understand the disease process. It's a chronic relapsing disease that by nature causes the patients, because of their interactions with healthcare, to be distrustful and to be, sometimes manipulative and sometimes just not honest. I mean, you need to understand that and work with it. Like I said, I don't think every diabetic you see tells you every cheesecake they ate over the past month. No. So if we can't depend on a patient's history to be perfect every time in any other disease, we shouldn't do it here either.